If you think about preventive care when it comes to physical health, I think we all know that there's things we can do to make sure that we're staying well, eating well, moving our bodies, getting a good night's sleep, right? When it comes to and we know that, and like whether we do that or not is a different thing, but at least societally we know that those are good things for us. When it comes to mental health, we haven't really gotten there yet, where it's like, I have a meditation practice, I have a journaling practice, I have this, I have that. So it's, what are the things that you're doing proactively to keep yourself mentally and emotionally well versus reactive care, which is, oh my God, my life is falling apart. Let me start meditating. Oh my God, I'm stressed with this. Let me call my therapist, or let me find a therapist, right? So it's about addressing things upstream. And we all know when it comes to preventive care for physical health, you get better outcomes if you're not waiting until something snowballs. It's the same with mental health, right? The more that we can build in those, kind of practices and support beforehand, the better it will be when life inevitably throws some kind of curveball at us that, we didn't see coming.
Diversity inclusion is a really big part of, of who you are, your values, kind of that foundational. In the larger group you have, the more diversity you have, and therefore the more you can probably see how well something is going to work across like multiple groups of people. I mean, that's just like my gut telling me that, but
For
correct
sure,
me
yeah.
if I'm wrong.
That's what I was saying. Like the more
Yeah.
global, the more diverse, the
Yeah.
harder to reach the employees. Like to the previous conversation, it's easier to reach a Gen Z or millennial employee who's working at their desk or is on their phone than it is to reach a rural, male, older, boomer manufacturing worker who's like,
Right.
not paying attention to the emails and doesn't tunes out mental health. But how do we engage them? How do we make it relevant for them where we can help them and support them? Because our mission is to help all people live happier, healthier lives, not just some that fit some particular demographic or type of work or location.
Obviously, the way that we offer mental health support for employees or even just anyone, right? Like as a consumer, you can sign up for, I'm trying to think of like one of those apps that you can just like enroll in for mental virtual.
Headspace.
Yeah, I think that's one of them. What do you think is working in mental health? What do you think, where are the opportunities? Obviously the proactive, you're answering the call here for like the proactive piece, I think, but like what's working? What can we do better? What do you love maybe that exists already today?
Yeah, what's working is people are paying more attention to this, and people and organizations. And that goes from not just HR, who, they're of course drinking the Kool-Aid, but senior executives are saying, hey, this is important. Yeah, well, we have more generations working in the workplace now than ever before. And so it's one of those things like you can complain about it. It's fun. There's something fun about just, hey, I'm just going to bitch and moan about this generation or that generation. But at the end of the day, what are you going to do, right? Like at the end of the day, the demographics are what they are. Gen Z will be the bulk of the workforce soon. Millennials will be the bulk of the workforce, soon, right? And so you kind of, evolve / adapt or die. And so for us Gen Xers or others, it's like you have to be sensitive to that. You have to learn and grow and evolve.
Yeah. I mean, I love it personally. It's certainly made me
It can be hard
behave
for us to
differently.
adjust to it, but I think it's a wonderful thing that, if the workplace is actually a safe place for people to actually be themselves, it never has been in this country before. It would be a very nice change.
We get a lot of information from three different sources. One, the employee themselves. The second is the company. And the third is the outside world. And so if we see, for example, that you're watching a certain type of content, for example, self-harm or domestic violence or things like that, we'll proactively reach out, not to say we saw you were watching that, but just to remind you that a human being is available. So just a gentle nudge, hey, in case you need it, we have somebody available. Same thing if something happens in the outside world. So for example, here in New York, there was that horrific shooting in Midtown, which even if you weren't living in Midtown, for me, my brother worked in that building, right? Like I know that I've been in that building 100 times. Like that's something that is really chilling because, anybody could be there. And so we reach out to say, hey, we know this may be a tough time. We're here for you in case you need it. Or
Well, acknowledging it that these things exist, even if sometimes people don't want to acknowledge it, they do. Yeah.
yes.
I love that. I mean, I'm here for all of that. Like that's where we are all different, right? And we're all walking very different paths of life. And, I say all the time, I'm like, well, I may be a woman, but I'm pretty privileged, and access in through my financial status and who my family is and all of these things. And I have to remind myself is that not everybody has had it this easy, and I think we need to acknowledge everybody's situation, right? Their personal situation, and there's always a mental health impact of that. I don't care who you are, and if you're in denial about it, you're in denial about it. So
You probably need some therapy.
you probably need some therapy.
This has been a Shut Up production.
Shut